Thanks so much. So thanks for having me today. So today I'll be talking. Is it
push
this
it down,
one?
yeah. Sorry.
Sorry about that. All right. So today I'll be talking a little bit about wellness initiatives in radiation oncology. So starts a little bit of background, why wellness matters, and then I started a pilot program at U of M. It's really in the beginning stages, but I'll talk about that, and then just a few concluding remarks. So just a little bit of background on wellness. This has been touched on earlier today, but wellness is often thought of as synonymous with well-being, but essentially a state of being in good health. Especially when it's sort of actively pursued. It's kind of interesting. This is from Wikipedia, and it showed patients' progress towards wellness as their example. But I think that's an interesting thought, because we often think of trying to make our patients well, but that sort of gets lost. Like our own wellness is not necessarily prioritized, but we have to be well in order to take care of our patients. And so I just have sort of a few articles throughout this background here. I won't go over them in detail, but there was this call to action in JAMA promoting balance in the lives of resident physicians, and there are sort of multiple dimensions of wellness that were highlighted in that article. So on the right side, professional wellness, physical wellness, psychological wellness, and social wellness. And these are all elements that I'd say professional is probably the most emphasized in our formal residency training, but social, psychological, or physical are maybe less emphasized. And so really why all of this matters, and something that I feel very passionately about, is that and has been touched on previously as well, is that there's really sort of this increased scrutiny on physician burnout in general, in particular residents. And so I just have highlighted here in red down there, it just sort of lumped all of oncology together. Although it's definitely lower burnout compared to like emergency medicine or something with very like high acuity, high stress situations. Oncology, we're dealing with cancer patients. We sort of absorb like these collective traumas of our patients without really having an outlet for dealing with that. And of course, physician suicides have been sort of more prominently displayed in the media now. And so there's this other JAMA article about addressing this physician burnout, the way forward. And so one of the ways to do that is to focus more on wellness and sort of make a concerted effort for that. And so just as sort of a personal note, there's sort of this, I guess it's sort of like a wellness representative at the University of Michigan, just very broadly, like within the whole university, called Healthy Champion. And so I was elected to that role this year as a PGY2, and I'll serve on it for like a 2-year term. And so the nice thing about that is it sort of connected me with a larger community within the University of Michigan, that now I have access to resources I wouldn't otherwise have, so like wellness curricula and things like that, that I haven't fully implemented those yet. But so I ran sort of a pilot session with residents just earlier this year. And so as has been sort of touched on in previous presentations, I didn't do this super formally, but just had a pre and a post survey just to get a sense of what people were interested in. This is something that has not really been done in the program before, and so luckily SurveyMonkey has a nice little color graph here showing what people were interested in. So meditation, board games, yoga, arts and crafts, healthy snacking, or other. It was kind of funny, someone put like a dunk tank for chiefs as one of the ideas. I don't know, we didn't do that, but just some fun ideas here. And so these are just some representative slides from that session. So I previously as an undergrad and throughout my life, I've sort of had a focus on healthy eating and sort of having a balanced diet. And so I actually brought in these healthy snacks for people to have. And so instead of just donuts or pizza, what we often have, I had sort of a reason why we had those, and just talked about why that's important to have energy to give to our patients. And then I actually did or sort of used a YouTube example of a guided relaxation. So that was kind of nice, one of those where you close your eyes and then sort of, like stress and relax different parts of the body. Usually it's like at the end of yoga that I've done that, but it was kind of nice just to do that. This was on a Friday afternoon, so I had to end the session early too, so people were happy to get out. And then we also just sort of went over a few ideas about what other wellness activities people would be interested in doing. So there's some rock climbing around, like a group cooking class, sort of things that we could do that would be sort of unique experiences as a resident class that wouldn't be mandatory, maybe could be funded through the department or through the university, and would just be a fun outlet to sort of get to know each other more personally and not just in the work setting. So I think one of the challenges and sort of some other initial ideas I'd thrown out that have maybe not been as well received were that it's tough because we don't really have dedicated time for this, and a lot people have families and other responsibilities, and so just finding a way that we can sort of focus on wellness but not make it seem too mandatory or too forced, but yet still achieve the goal of just taking care of ourselves. And so I hope to work on this more. And so these are just a few responses from that post survey. It might be a little hard to read, but essentially people liked the snacks and sort of time to socialize with other people, so those are always good things. And then people were pretty interested in sort of all the ideas that we had talked about, picnic, happy hour, brunch, rock climbing, one of those paint and pour things, and then sports. And so actually we do have a softball league that I've been a part of, and so that's been kind of fun. I'm the only resident doing it so far, but that's a fun way to sort of bond with the department as well. So just some concluding remarks, and would be open to ideas here, because I'm really just in the beginning phases of all this. But residency is challenging. Of course, being and attending sort of at any stage, work is difficult. But wellness really does matter, and especially carrying the responsibility we have for our patients as a physician, it's important to really take care of ourselves and to know that our own wellness is very important. And it is possible to integrate this, informally or formally into radiation oncology. So we can be happier and well, then we can provide better patient care. So, all right. Thank you so much.